Not everybody specifically knows what an orthopedic surgeon is or what a hand surgeon is and how those might be designated. Sometimes as an orthopedic surgeon, people have come to me and said, well, I thought you do just feet. But no, that's not actually true. That's called a podiatrist who just does feet and maybe ankles as well. Orthopedic surgeons take care of everything from the neck all the way to the toes, but most of us today are getting into a more specialized area, and that's a good thing. Wherever you happen to be doing most of your work as an orthopedic surgeon, you're going to be excellent at that. Anything that you don't do commonly or regularly, certainly you're capable of doing, but it's with a lot more concentration and thought into making sure all the steps are being managed in a good way. That goes to be true even during surgery, but just in general for treatment of a patient overall. So hand surgery is actually a American invention. It started during World War II. During World War II, there were a lot of soldiers that were coming back from Europe with injured hands, and unfortunately, they were very stiff, and that made them disabled. So they weren't really able to return to purposeful work and purposeful activities. So the military asked for some help, coincidentally, from Letterman Army Medical Center in San Francisco, and spoke to a surgeon there who happened to be exploring and developing the science between or underlying the treatment of hands. And his name is Sterling Bunnell. Sterling Bunnell was a community orthopedic surgeon, but in his era, they were also sometimes doing research. Bunnell had better results with care of hands than most other surgeons were typically getting. So the military actually came to him and said, "Can you help us?" And he said, "Well, I'm only one surgeon. What we need to do is train other surgeons." So he set up 10 centers around the United States, taking time away from his medical practice, and he would train surgeons to take care of hand injuries. Up until him, typically there were specialized surgeons doing each thing. The orthopedic surgeon would take care of the broken bones in the hand. The plastic surgeon would repair the tendons, make sure the skin was covered. The neurosurgeons would cover up or repair nerve injuries. But unfortunately, after surgery, the orthopod didn't want to let anything move. The plastic surgeon wanted to keep things moving so it wouldn't get scarred down. And the neurosurgeons didn't want anything to be moved at all. Their delicate work, they didn't want to be compromised. So Bunnell said, "I will only teach young interns that have not been specialized into something else because I need to teach them neurosurgery, plastic surgery, and orthopedic surgery, and how to manage the patient after surgery has been completed, which usually includes some degree of therapy." So Bunnell is an interesting figure. Bunnell actually taught Dr. Carroll. Dr. Carroll taught Dr. Wood. Dr. Wood taught me. So I have a heritage that goes directly back to Dr. Bunnell and his teachings.